Welcome to Omni Academy. This is Maria, and today we are starting our second lecture on the development of tongue. In the last lecture, we completed the development of tongue, and in today's lecture, we will be discussing a clinical scenario related to the development of tongue. So let's start our today's lecture. So the scenario is a boy is brought to you due to difficulty in speech. On questioning, you came to know that the boy is unable to pronounce T, Z, S, N sounds. Examination reveals more extension of lingual frenulum. Or this scenario can also be asked in a different way, which is newborn brought to you with complaints of excessive crying during breastfeeding. Mother noticed particular noise during feeding. She also noticed his dry pampers. Oral examination reveals lingual frenulum was extending near tip of tongue. So this is image of the patient. So before discussing the diagnosis and the embryological basis for the condition in the scenario, let's talk about that what lingual frenulum is. You can see in this diagram that this is the normal lingual frenulum. Lingual frenulum is a small flexible band of mucosal tissue connecting the underside of the tongue to the floor of the mouth. It stabilizes tongue movement and support functions like speaking, swallowing, and eating. So let's now talk about the diagnosis. So the diagnosis of the scenario is Ankyloglossia, and we can also call this condition as tongue tie because the tongue is tied to the floor of the mouth. So let's now talk about the embryological basis for the condition in the scenario. Ankyloglossia occurs due to failure of cellular degeneration in lingual frenulum. So what happens actually during the development of tongue is that lingual frenulum is a thicker band and it is connecting the entire undersurface of the tongue to the floor of the mouth, thus restricting the free movement of the tongue. But after some time during the development, cellular degeneration occurs in the lingual frenulum, making it smaller, thinner, and shorter, thus allowing the free movement of the tongue. Because now the lingual frenulum, after becoming shorter, is not attaching the tip of the tongue to the floor of the mouth, so the tongue can now move freely. But in some patients, cellular degeneration in the lingual frenulum fails to occur, so the lingual frenulum remains abnormally thick, restricting the tongue movement in such patients. As these patients are unable to move their tongue, and we know that to swallow or to drink anything, tongue movement is required. So, this restricted tongue movement is making them unable to drink or swallow anything. That's why the pampers of the baby mentioned in the scenario are dry because he is unable to drink milk properly. So this was today's lecture. In the next lecture, we will be starting the development of ear. So see you in next lecture.